Mastering Patient Advocacy and Safe Delegation in Nursing Practice. Introduction to Advocacy and Delegation. Welcome to NCLEX RN's Safe and Effective Care Environment Management. Today we'll explore two critical nursing competencies that form the foundation of professional practice. Key focus areas include advocating effectively for client rights and needs, delegating tasks safely to appropriate personnel, understanding the legal and ethical framework surrounding both practices, advocating for client rights and needs. As professional nurses, advocacy represents one of our most important responsibilities. This involves promoting patient autonomy, respecting patients' right to make their own healthcare decisions, safeguarding patient interests, protecting patients from harm and ensuring their voices are heard, supporting navigation of healthcare systems, helping patients understand complex medical environments, ensuring access to quality care, removing barriers that prevent patients from receiving appropriate treatment, understanding essential patient rights. Every patient has fundamental rights that nurses must protect and uphold. Privacy and confidentiality. HIPAA compliance in all interactions. Secure handling of patient information. Protecting sensitive health data. Informed consent. Comprehensive communication about treatment options. Ensuring patients understand risks and benefits. Supporting decision-making processes. Patient autonomy. Respecting patient decisions, including treatment refusal. Honoring cultural and personal preferences. Supporting self-determination. Safe and respectful care. Protection from abuse or neglect. Culturally competent care delivery. Maintaining dignity in all interactions. Empowering patients through effective strategies. Successful patient empowerment requires systematic approaches. Patient-centered care. Respecting individual preferences and values. Involving patients actively in decision-making. Tailoring care to meet specific needs. Enhancing health literacy. Using clear, understandable communication. Providing appropriate teaching aids and materials. Checking for understanding regularly. Supporting self-management. Educating patients about chronic condition management. Teaching when to seek medical help. Providing resources for ongoing care. Advocating for vulnerable populations. Special attention to elderly patients, children, and individuals with disabilities. Addressing unique needs and challenges. Ensuring equitable care access. Overcoming common advocacy barriers. Nurses frequently encounter obstacles when advocating for patients. Cultural and language barriers. Solution: utilize professional interpreters. Develop cultural competence through ongoing education. Respect diverse perspectives and practices. Time constraints and institutional policies. Solution: implement effective time management strategies. Seek peer support and collaboration. Understand organizational resources. Moral distress and personal biases. Solution: access ethics committees for guidance. Engage in reflective practice. Pursue continuing education on ethical decision-making. Understanding delegation principles. Delegation involves transferring responsibility for specific tasks while maintaining overall accountability for patient outcomes. Key benefits: enhances workflow efficiency, improves team collaboration, maintains high-quality patient care, optimizes use of healthcare resources. Critical understanding: the delegating nurse remains accountable for the outcome even when tasks are performed by others. Scope of practice guidelines. Understanding each team member's scope of practice is essential for safe delegation. Registered nurse, RN, responsibilities. Comprehensive patient assessments. Patient and family education. medication administration and evaluation, care plan development and modification, licensed practical nurse (LPN) capabilities, basic nursing care under RN supervision, medication administration within scope, patient monitoring and data collection, implementation of established care plans, unlicensed assistive personnel (UAP) functions, activities of daily living assistance, vital sign measurement, basic patient comfort measures, non-clinical support tasks. The 5 rights of delegation framework. Safe delegation requires adherence to 5 fundamental principles. 1. Right task. Task must be appropriate for the delegatee's skill level. Should be within their scope of practice. Must not require nursing judgment. 2. Right circumstances. Patient condition should be stable. Environment must be supportive. Resources should be readily available. 3. Right person. Delegatee must be competent and qualified. Should have demonstrated ability. Must be willing to accept responsibility. 4. Right directions. Provide clear, specific instructions. Set expectations for completion. Include timeline and reporting requirements. 5. Right supervision. Maintain ongoing oversight. Be available for consultation. Evaluate outcomes and provide feedback. Effective supervision and evaluation. Successful delegation requires appropriate levels of supervision. Direct supervision. RN physically present during task performance. Immediate guidance available. Real-time feedback and correction. Indirect supervision. RN readily available for consultation. Periodic check-ins and progress monitoring. Support provided as needed. Post-task evaluation. Assess patient outcomes. Provide constructive feedback. Identify learning opportunities. Document results appropriately. Communication excellence in delegation. Effective delegation depends on clear communication. Essential communication elements. Provide detailed, specific instructions. Confirm understanding before proceeding. Establish clear expectations and deadlines. SBAR framework application. Situation, describe the task required. Background, provide relevant patient context. Assessment, explain the importance and priority. Recommendation, state expected outcomes and next steps. Mutual understanding. Encourage questions and clarification. Use teach-back methods when appropriate. Document important communications. Mastering advocacy and delegation. Advocacy and delegation represent core nursing competencies that directly impact patient outcomes. Remember that effective advocacy ensures patient rights are protected and voices are heard. Safe delegation improves care efficiency while maintaining quality standards. Mastery of these skills enhances teamwork and promotes positive patient outcomes. Continuous learning and practice strengthen these essential abilities. Thank you for watching. Continue building these foundational skills as we progress through the remaining modules.